Before we begin, this video is for educational purposes only. Always talk to your doctor or pharmacist.
Mom got confused. Is it the UTI or the antibiotic? If you've ever stood in the kitchen at 10 p.m. trying to figure that out, this video is for you.
Here is why this gets so tangled. Confusion in seniors is a louder symptom than most people realize. A urinary tract infection, a UTI, can cause sudden confusion in an older adult. The infection sends inflammation through the bloodstream, and an aging brain is more sensitive to that inflammation than a younger one. That is why a parent who is sharp on Sunday can be foggy on Wednesday. But here is the part most families never get told. The antibiotic that treats the UTI can cause the exact same confusion. Older bodies clear drugs more slowly. The kidneys and liver don't work as well as they used to, so a dose that's fine for a 40-year-old can build up in a 75-year-old and reach the brain. That is especially true for drugs cleared by the kidneys, and that includes both Cipro and Bactrim, two of the most common UTI antibiotics.
There is one layer almost no caregiver hears about. Some antibiotics used for UTIs are well known to cause confusion in older adults through different mechanisms. Bactrim crosses easily into the brain and can disrupt folate and sodium levels. Cipro and Levaquin, the fluoroquinolones, actually lower the seizure threshold in the brain. The FDA put a warning on the fluoroquinolone class in 2018 specifically for confusion, delirium, hallucinations, and disturbances in attention. Then there is a second layer. Many older adults are also taking what is called an anticholinergic drug, that is Benadryl, Zygquil, Tylenol PM, oxybutynin for bladder, or some older antidepressants. The American Geriatric Society's Beers criteria flags every one of these as drugs to avoid after 65 because they can cause confusion that looks like sudden dementia. If your parent is on one of those and then gets an antibiotic on top, you have stacked two delirium risks.
Let's slow down and look at the symptoms side by side. A UTI in an older adult might show up as sudden confusion, plus burning when they urinate, plus a fever, plus going to the bathroom more often, plus new pain in the lower belly, plus new incontinence. Some older adults won't run a strong fever at all, and that's important to know. An antibiotic side effect can look like sudden confusion, plus agitation or restlessness, plus not eating, plus dizziness, plus stomach upset. Now here is the trap. Cloudy urine or smelly urine alone is not a UTI. Most older adults have some bacteria in their urine without an actual infection. The official guidance from the Infectious Diseases Society of America is don't treat that. Treating bacteria with no symptoms is exactly what creates the antibiotic delirium loop this video is about. Also worth checking before you assume UTI. Has your parent been drinking water? Dehydration alone can cause confusion in older adults, and dehydrated urine smells stronger.
So, what do you actually do when this happens? Here is the order. First, check the medication list. Look at every new medication started in the last 7 to 10 days. Pay extra attention to anything ending in -fluoxetine like Cipro or Levaquin, anything called Bactrim or Septra, and any over-the-counter sleep aid or allergy medicine with diphenhydramine in it. That's Benadryl, Zygquil, Tylenol PM. Second, know the 3 signs that mean call 911 right now. 1. A fever. In an older adult that's any temperature over 100 degrees Fahrenheit or 2 degrees above their normal baseline. Older adults often don't mount big fevers, so don't wait for 101 or 102. 2. They cannot stay awake or you cannot wake them. 3. They cannot recognize you or they are seeing or hearing things that aren't there. Any one of those you call 911? Third, if it is not emergent, call the pharmacist. Pharmacists are the fastest experts on drug side effects and they usually pick up the phone. They can tell you in 2 minutes if it sounds like the drug.
Let me walk you through a real scenario. Mom was fine on Sunday. Started antibiotics for a UTI on Tuesday morning. By Wednesday night, she is confused, agitated, won't eat dinner. You are scared. Here is exactly what you do, in this order. Step 1, look at the pill bottle. Is it Bactrim? Is it Cipro? Is it something ending in -floxacin? Write the name down. Step 2, check her temperature. If it is over 100 degrees, call 911. If she cannot stay awake or cannot recognize you, call 911. If it is normal or low grade, you have time. Step 3, call the 24-hour pharmacy line on the bottle. Step 4, when the pharmacist answers, say this: My mother started this antibiotic on Tuesday for a UTI. As of tonight, she is confused and agitated. Is this a known side effect, and should I stop giving it before her next dose? That sentence gets you a real answer in 2 minutes. Step 5, write down what they say. Step 6, call the prescribing doctor's after-hours line and read the pharmacist's answer to them. Most of the time, the doctor will switch the antibiotic to one with a lower risk of confusion in older adults. If your parents' kidneys are working well, nitrofurantoin or fosfomycin are common alternatives for an uncomplicated UTI. The confusion usually clears within a few days of switch.
Here's the bottom line. You know your parent better than any doctor in any office. If something is suddenly off, trust what you see. Then ask the right people the right questions. If it is emergent, fever can't wake them, can't recognize you, call 911. If it is not emergent, the pharmacist first, the prescribing doctor second. Watch Over Health is here to help you ask those questions and to give you the language to ask them. New platform coming soon. Follow us for more medication safety tips your doctor forgot to mention. Link in bio.
Watch Over Health. New platform coming soon. Follow for more medication safety tips your doctor forgot to mention.